from the beginning. Hi, we're Group 5 and we're doing Scenario 1, which deals with pediatric fear and family communication. Here is the conflict.
Hi, I'm your nurse.
No, get out of here.
Oh,
I don't want you, sweetie. In this scenario, a 5-year-old child named Ty is anxious about a medical exam due to a previous hospitalization. The nurse must use play techniques to gain Ty's trust while clearly communicating with the parent. Step 1, open-ended questions.
How's it going?
I don't want to be here.
Oh, that's weird. Why?
Because the needles.
Oh,
It's gonna hurt me.
okay? Does it hurt?
Yes.
Oh, is it always like that?
Yeah, we're pretty worried.
Oh, huh.
That was an ineffective use of open-ended questions. The nurse was not properly engaging the patient or her mother. She was asking closed-ended questions, which should be reserved for narrow-focused assessments and emergent situations where the patient's emotions can be secondary, according to Boggs, 2023, page 66. Additionally, the nurse dismissed the patient and her mother's concerns, which is unempathetic and goes against the Society for Critical Care Medicine's recommendation to include the family members to improve communication, satisfaction, encouraging engagement, and empowering the patient and the family, according to Boggs, 2023, page 165.
How's it going?
Not good.
No. Why's that?
Because I don't want to be here.
That's fair. How are you feeling?
Scared.
Well, why do you feel scared?
Because of the needles.
Oh, is it always like this whenever she goes to the hospital?
Yeah, she's scared of needles. We were a little worried because she seemed sick and we heard there was something going around, so we just wanted to check.
Okay, so we'll work on that. Can you tell me a little bit more why you're scared?
That was an effective use of open-ended questions. The utilization of open-ended questions allows patients and family members to use their own words to elaborate on their health needs and concerns, according to Boggs, 2023, page 68. In this scenario, we saw the nurse ask the patient why she was scared, rather than just leaving it at closed-ended questions with yes or no responses. The nurse also included the parent, asking for more background regarding both the patient and the parent's concerns. This allowed the patient to express why she was scared and the parent to express why she was concerned about her child. Hence, we can see in this scenario how open-ended questions provide a broader context for the patient's and family's concerns, which help the nurse provide better, more holistic care specific to the needs of the patient, while taking the parent into account as well, according to Boggs, 2023, page 68.
It hurts. And I bleed a lot.
The next skill is active listening.
Okay.
Are you listening to us? Can you hear her?
Okay.
That was an ineffective use of active listening. Although she may have been hearing the patient, the nurse failed to use nonverbal behaviors to convey attentiveness. Active listening, quote, involves more than simply hearing words, end quote. Yet her body language, specifically having her back turned and focusing on writing, did not communicate engagement or interest, according to Boggs, 2023, page 67. This lack of attentiveness prevented the development of a positive provider-patient relationship, as the patient and parent did not feel heard. Furthermore, active listening, quote, requires full attention to understanding the patient's perspective without making any judgments, but the nurse's tone suggested a level of judgment, which can further hinder open communication, according to Boggs, 2023, page 67. While she was technically listening, she did not incorporate essential components of active listening, such as eye contact or responsive body language. As emphasized, active listening, quote, conveys attention using nonverbal behaviors such as leaning forward and nodding the head, end quote, all of which were absent in this interaction, ultimately resulting in ineffective communication, according to Boggs, 2023, page 62.
Oh, so you're scared? Yeah. The needle hurts. And all my friends at school said it hurts too. And I didn't get the princess band-aid.
Oh, so you wanted the princess band-aid?
Yeah.
We're just a little scared because we heard something was going around, so we wanted to get her checked, and she's afraid of needles, so.
Okay, so she's afraid of needles.
That was an effective use of active listening. The purpose of active listening is to understand what the patient is attempting to explain when they express their thoughts, feelings, and concerns, according to Boggs 2023, page 67. In this scenario, the nurse gets down to the child's level, showing body language that expresses empathy, engagement, and establishes an equal relationship, according to Boggs 2023, page 67. When the nurse listens to the child's concerns, asks questions, nods their head, and responds with I see or it shows that the nurse acknowledges and validates the child's feelings and ultimately displays active listening, according to Boggs 2023, page 62. The next skill is empathy.
Needles aren't that bad. You'll be fine. It's not that scary.
Are you sure?
Yeah.
I'm scared.
That was an ineffective use of empathy. The nurse dismissed the child's fear by saying things like, needles aren't that bad, and you'll be fine, it's not that scary, which minimizes the patient's feelings instead of acknowledging them. Empathy requires recognizing and validating a patient's emotional experience, but in this situation, the nurse ignored both the child's fear and the parent's concern. This type of response can make a patient and family feel unheard and unsupported, which may increase anxiety and damage trust. As emphasized, empathy involves understanding the patient's feelings and communicating the understanding rather than dismissing their emotions, according to Boggs 2023, page 61.
It's okay to be scared. Your mom and I will be here to support you. Is that your toy?
Samantha.
Samantha's her name?
Yeah.
Is it okay if I do a quick assessment on her?
Okay.
Okay, I'm gonna check her blood pressure on her arm right here. It's gonna give her a little squeeze. And then I'm just gonna check her mouth. Can you open your mouth, Samantha? Is it okay if I do this assessment on you?
Okay.
That was an effective use of empathy. The nurse acknowledged the child's fear by saying, it's okay to be scared, which validates the child's emotions and helps build trust. The nurse also reassured the child by offering support and understanding, showing that their concerns are being taken seriously. This response reflects empathy by recognizing the emotional experience of the patient and responding in a compassionate and supportive manner. Empathy helps strengthen the nurse patient relationship and promotes a sense of safety and comfort, especially in pediatric settings, according to Boggs 2023, page 61. By using the skills of open-ended questions, active listening, and empathy, we have successfully navigated this patient interaction and resolved the conflict. Open-ended questions are unbiased, non-judgmental, and allow a patient to express themselves freely and provide more information, according to Jarvis and Eckhart, 2024, page 23. With active listening, our patients feel heard and encouraged to continue talking about their concerns and observations and helps build rapport, according to Testonia et al., 2024. Empathy, according to empirical research, plays a huge role in improving patient outcomes and experience. Training this skill is wholly possible and effective, according to Nembhard et al., 2022. We can now use these skills moving forward to resolve conflicts in our clinical practice.
Thank you for watching.